Hey everyone, and welcome back to Damn Parenting, your English-speaking parenting podcast from Amsterdam. And we are your hosts, Maren and
Eva.
This is another theme month after we have wrapped up September with the topic of matrices, which of course you can all listen back to the wonderful episodes that we have covered this topic with. And October is a new month, so we thought the theme months are fun because we can really dive into a topic. And one topic that has been very relevant for us and especially for Eva was ADHD. And October is the worldwide ADHD awareness month, or is it just our awareness month?
I think it's worldwide. I think I'm always choosing the worldwide recognitions because the Dutch ones are it's Bakfietsday or it's, these things. So, yeah.
Which we can also do an episode on. But now we're diving into a full month of covering ADHD and ADD. Here we go. Yeah. So this is the first start. So let us get those acronyms right. So we are talking about ADD and ADHD from different angles. And one of the angles is Eva's personal story with this topic. We want to come back a little bit to the main reason why we started this podcast, bringing you expert information and also making the route for the people who are coming after us researching certain topics a little bit easier. So this was one of the topics where Eva had to go 3 different loops to go where she needed to end up in the end. So we thought, let's make this easier for anyone who has to go through the same process or has gotten in contact with this topic and doesn't know where to start getting information or how to get a diagnosis and what even the process is. So this is really another piece of information in our library, building up the content for how to navigate the Dutch medical system with the specification of how to get diagnosed and get into the field of the whole topic of ADHD and ADD. And I'm going to pass the torch over to you, Eva, and you can tell us a little bit more about what we are expecting this month.
Yeah. So as Maren said, we started this podcast 11 months ago. And 12 months ago, I ended up with my own diagnosis of ADHD, funnily enough. So before the podcast started, I was dealing with quite a lot of new information and things going on. So in the last 12 months, I've actually been interacting quite a lot with different people and I'm seeing quite a lot of conversations happening. And it evolves around parents' side of managing their own ADHD. When children have ADHD, how to manage that. We already spoke with Anne Graham, who wrote the book Jelly Pie Firefly, that came out earlier this year. And she did that because she didn't know where else to go to help support her own child. And so she wrote her own book. I mean, that's what some of us have to do is we're trying to figure out what we're meant to do. And so some parents, some people are having to resort to creating their own way. And as you say, we're just trying to pass on the information that we've gone through. And so you can check back to that Jelly Pie Firefly episode so you can listen to her and her own story on writing her own book. Equally, we're going to have Emma come back to us. She was on with us previously about dealing with ADHD in our maternal mental health. She's going to be joining us to help talk about ADHD in motherhood, but specifically about boredom, because boredom is a magnificent killer for anyone with any diagnosis you might have. Anyone who gets bored, it's very hard to deal with, but especially when you have ADD, ADHD. We will also be having a few other people joining us with their own personal stories and helpful tips as well this month. I'm not going to fully divulge into it yet because we're still working them out ourselves. But for now, my own story is, I think we discussed about it and you're like, are you going to share your journey? And I kind of stopped because I was thinking, it's that thing where, here's a label for you. And yeah, I'm like, I don't want a label. And it was one of those things that it's a case of, I don't need to be, she's got that, there's one of those things. So with that, I got on my own little research and I was able to find a PhD student called Marlies Visser, who is at the VU University doing her PhD on stigma and mental health. And I had a quick chat with her about stigma, specifically targeting ADHD here in the Netherlands. So here it is. First, though, we wanted to understand the stigma element more, so we reached out to Marlies Visser, a PhD student in the VU who's writing her thesis on health-related stigma. Hi, Marlies. Thank you for joining us here on our ADHD series in October.
Yeah, thank you so much for inviting me.
A study you conducted focused on stigma related to persons with ADHD, covering stereotypes, prejudices, and discrimination here in the Netherlands specifically, and the effect this may have. So can you give us an overview of what is included?
Basically, what we noticed is that research in ADHD related stigma was quite limited. And then specifically the qualitative research. So there is some research using questionnaires, for example, which is more quantitative focused. So we wanted to really add to this qualitative perspective to kind of see what are the perspectives and what are the lived experiences of individuals with ADHD, but also, for example, parents of children with ADHD, health professionals, and primary school teachers. What are their experiences with their daily life, basically? And stigma, or the way that it's defined across the literature, is, like you said, stereotypes that you can have either a positive or a negative stereotype about a person or a group of people. And basically, stereotypes turn into prejudice when a negative stereotype is endorsed. And that can then turn into discrimination. And together, those elements basically define stigma. So with ADHD, for example, you can think of a stereotype. Oh, okay, people with ADHD are hyperactive. Then that turns into prejudice when, okay, you have ADHD, so you must be hyperactive. And that then turns into discrimination. If it's, okay, you have ADHD, so you're hyperactive, so I don't want to do this school project with you, or I would not want to hire you. Or it can be internalized if you say, oh, I'm chaotic, so I might not be able to do this, or so I'm not going to apply for that job, for example. That's, I think, a very short explanation of what stigma can look like.
And when we talk about stereotypes and prejudices that we have, what did you find between the children versus adults with ADHD?
Yeah, so we did, so the qualitative research, we did a focus group study. So we talked to groups of young adults, men and women with ADHD. And we also talked about their experiences in childhood. And we also talked with parents with children with ADHD. And from those conversations, there were some common themes that were recurring through our conversations, basically. And it's really this idea of this rejection of the concept of ADHD. So responses like, oh, when people tell, right, okay, I have ADHD, and then responses like, oh, yes, you want to belong, right? Or ADHD is a fashion phenomenon, ADHD is a fabrication. So basically this response is telling others that their experience is not valid or not real. That was something that came up like in our conversation with parents about their children, but also among the young adults, which of course that can have a big negative impact on you if you don't feel acknowledged in your experience. And then another recurring theme was seeing ADHD really as a deficit. Characteristics associated with ADHD were then seen as negative mainly. So you can think of people being blamed of like, oh, you just need to try harder, or you need to toughen up and push through and you'll be fine, or you need to be more organized, basically. So not seeing kind of the strengths that could also be associated with ADHD, but focusing mainly on the negatives, just seeing the hyperactivity or that you are disruptive, for example, instead of seeing the balanced picture of both the challenges, but also really the strengths and the strengths that come with ADHD. And thirdly, it's really these misconceptions that keep returning. So the stereotypes of ADHD, of like, this image of ADHD as a young hyperactive boy, which I think still is very much very pervasive in all of people's experiences. So both for women, but also for men that do not present their ADHD through hyperactivity, for example, they're struggling with that too. And a lot of women, telling us like, oh, I never fit that image of being hyperactive in school or not paying attention, or and I'm a woman, so therefore I'd never fit that image. So I just never figured that I could have ADHD, and it hasn't been recognized, also not by others throughout my life, resulting in a delayed diagnosis, basically. And lastly, I think with that, so that third theme of misconceptions, really those experience of trivialization, I have to say it right. Responses like, oh, yes, everyone has a little bit of ADHD, or we all have trouble planning sometimes. Basically this response of you're overreacting or exaggerating, and it's not that bad, basically. So I think, those were three of the key themes of like stereotypes and prejudice that both children and young adults faced. Yeah, I should add, they also, the young adults also definitely mentioned some more positive responses, like they know, like, oh, people see them as creative, or they see them as open, or there are definitely instances where that happens, but across the board, the negative responses and the negative stereotypes and prejudice were more common.
So you mentioned there a very typical and well-known example, which is the young boy that is very hyperactive, and everyone can kind of say, yes, that's definitely someone we see as ADHD. What other gender-specific impacts and needs for care and support were found in your study?
Yeah, so indeed, what we did is we had separate conversations with young adult men and young adult women with ADHD. I think during those conversations, they all mentioned that they really struggled with this lack of understanding, firstly, then the lack of appropriate support and discriminatory treatments, so not being able to access the right care or being excluded from a classroom, for example, and that those experiences really impacted their self-concept, so the way that they viewed themselves. But in terms of gender, what we did identify, we compared those responses, that there were nuanced gender differences in how, the experiences with the lack of understanding and the lack of appropriate support. So, for example, the women that we spoke to, they really mentioned a lot of experiences with skepticism, for example, like, okay, are you sure that you have ADHD? People not believing that they could have ADHD because they might not fit the image of ADHD that others have, for example. And that then, in terms of impact, really led to more often a delayed diagnosis. So the women that we spoke to were like up to 30 years old, so being diagnosed in their 20s, and then thinking back, like, what happened? Why did no one notice? Why did I not know? So that was quite specific for the women we spoke to, and that really led to their reflections on, or impact for them on their identity and their identity development over the past years. They've struggled with masking at all, and also feeling lonely. So of course these experiences can be more general. I'm not saying they're specific to women, but it's just the women that we spoke to, this came out more clearly. While then comparing to the men that we spoke to, they, in terms of this lack of understanding, they experienced way more. I don't know if it's more, but at least they told us these experiences of really the social rejection, right? People being very negative about you, saying you have to push through, or to be tough, to not, that you're exaggerating, or also instances of not being taken seriously, like, oh, these instances of boys will be boys, so this is just behavior that you're going through and you'll be fine. But then they didn't actually get the support that they would have wanted actually at the time, to also learn themselves how to manage their ADHD, but also just to generally feel included. And then, in terms of their self-concept, it was really this negative attributions, internalized feelings of, I don't want to say to anyone that I have ADHD. And also it could really reduce their help-seeking behavior. It reduced their willingness to actually go and see a healthcare provider, for example. So I think these were just some nuanced differences, and of course they can be shared among boys, girls, men, women. But I think there are some patterns there that are interesting or important to distinguish, I'd say.
Well, thank you so much for your time. We greatly appreciate it. You really highlighted a few things that I think many of us hadn't considered, and many of us have experienced as well. So thank you so much for sharing your research, and best of luck with it getting published quickly and soon.
Thank you so much. Thank you for inviting me. I think this is really also an important space to highlight these issues and to kind of put them on the agenda. To also, they can be hidden at times and they can be underestimated, but I think it's important to get it out there, that we take these experiences, to highlight these lived experiences, take it seriously, and use those insights really to make content, like education, healthcare as well, to make those places more inclusive.
So there you have it. As you can hear, it's a case of we are suffering from it. And the thing is, men and women suffer very differently. Whereas the men are, you just got to get over it and, man up. And the women are, just manage yourself. You just mask, basically, which is what women are, told we are doing. As girls, you're masking, and that's why it's harder for girls to get diagnosed with this. Whereas with boys, it's like, oh, you're just full of energy, just man up, mature, be more mature. At the end of the day, it is one of those things that we have to kind of step over the stigma. And we've done this quite a lot. Like we've had a lot of raw conversations in the last year about certain topics that we're trying to break the stigma. So hence, I guess I'll just share part of my journey about how I got diagnosed. And so it actually started at the beginning of 2023, where my therapist just looked at me saying, has anyone ever suggested you might have ADD? And I looked at him like,
another number for me to pick.
I was just looking at him like going, no, why? And he just goes, well, I'm just wondering. I was like, and he said, well, let's look at it. So to do that, my therapist, with the suspicion, my therapist is like, we got to go to your house arts. So I had to go to my house arts. Now I basically communicate with my house arts via a message app, not WhatsApp, but their Zork domains thingies, the apps that they have. So I just sent her a message saying, my therapist thinks I have ADD. Can you please help me get an appointment, to get this tested? And she messaged back saying, I need diagnosis symptoms. So it was the DSM-5, which you have to go through. There's no specific, it's not like you've got a broken arm, here you go. It's a little bit more to it than that. I ended up going in actually to meet my doctor, and I kind of just said, okay, these are the symptoms. He said, here's his number. She had a phone call with him to have the conversation. And then she said, okay, let's do this. And she sat on her computer and she typed in, there's all different kinds of ADHD research places, like to see if you have ADHD, diagnosis places, should I say. And she would type in a name and it would actually show how many days waitings there are. Mm-hmm. And so I was a bit like, one of them was like, no, wait list is closed. So she was like,
okay, wait list is closed.
Oh yeah. So she was really like, oh, okay. So she ended up finding this place called ADHD Centrum, which is beside Sloterdijk train station. And my wait list was 9 months. And so I went, oh, so what do I do with this? And she was like, well, you wait. So I said, okay.
At least you don't have to take a course this time, right? And no eating dates and no drinking raspberry leaf tea this time.
Yeah. So I was like, okay, let's do this. So it was 9 months of waiting. And unfortunately, as I think everyone who's probably going to listen to this and anyone who doesn't even listen to this, we know if we speak about something in a room where our phone is sitting, our phone is now going to be triggered to show us up the topic. And so for those 9 months, my Instagram feed just became everything about ADD related or ADHD relation. And it was quite, I was like, oh, that's me. Oh, that's me. Oh, and it became this whole thing that it consumed me. It was to the point that I was like, oh, I'm programmed to have this now. So I have it. Mm-hmm. And so when I went in to get my test, I was told it's a whole day. I had to be in at 8 in the morning and I should be finished at around 4 in the afternoon, and that there will be a medication provided to me once they've done the test if I have it to see if this works. So I thought, okay, this is not what I expect, but sure. So up I rock, I go in and it's just a building office, and I went in, I checked in, and then I went and I spoke to a therapist, a psychiatrist, a nurse, all different appointments. Like you go into different rooms to have different conversations. And then after a while, I was then given this test. I went into a room and I sat down with this funny looking thing put on my head with a ball and a camera looking at me. And I had to press this button following this like routine on this computer. Every time I saw something, I had to press this button. And I think it was like 20 minutes. And oh my God, it was the most exhausting thing that you're like trying to focus on it. And we walked back into the other room and they were like, you have ADHD. And I went, I do not have H. And she was like, you have H. And so I just like, so what does this mean? She's like, well, we're going to give you some medication. I think it's methamphetamine. We're going to see how that works. So they gave it to me and they said, you might get a bit warm. Your hands will get a little sweaty. Your head will kind of get a bit buzzy. And I thought, okay. So
great.
We did.
Sign me up.
So we did. And we went back in and I did the test and it showed that I improved it. So they said, yes, this is good medication for you. And this is going to help you. If you want to proceed, I can immediately start giving you medication. This is how we're going to do it. And I thought, okay, so I took the medication, I improved, I came out and they said, okay, this is it. Here's your medication from now on. And I was looking at them thinking like, wait, what? Like what? What I was going to have is every 2 to 3 weeks, I'd have a nurse call me for like a 45-minute check-in to see how the medication was working and also to up it dosages or to see how we manage dosages. The first medication I was given was methamphetamine, which is an extremely strange substance to be given to someone who's hyperactive in the first place. Because you're like, this is like literally like manic giving manic. And apparently it's like plus equals minus, it's minus and it was a very strange way they were trying to explain it to me. Unfortunately, it ended up causing me a severe anxiety to the point I was sick. I couldn't sleep. I was just absolutely in bits for a few weeks. And so within, I think, 8 days, I rang them going, I can't do this. Like, I literally am about to break down. And so they're like, right, stop the medication immediately. They said, there's another one we try. So I said,
were you under supervision at this time by just that Centrum, or you were with your house arts or your therapist, or who was like monitoring you?
I was seeing my therapist, as I always do, but my house arts, no, it was just the Centrum themselves who were going to have a call with me every 2 to 3 weeks. But by day 8, I rang them up going, I can't do this. Like, I'm literally about to break. So they said, okay, well, what we do is in the Netherlands, you have 3 medications you go through. So there's methamphetamine, and then there's, I'm going to forget all these other names, dis something lax, which is Elvina, and then there's a third one, and you have to go through them step by step. To reach the next one, you have to have done the first one. This is by Dutch insurance law. You have to do this for it to be covered under insurance. So I did, and we went to the next one, and I tried that, and that had no effect. And then I ended up on the third one, and I was doing that one, and there was still no effect. And then they said, okay, let's max your dosage on that, and let's give it another 3 weeks. So I did. And again, there was no effects. And if anything, I was feeling more and more uncomfortable in myself, I guess was the only way to put it. And I just thought, this isn't working. I'm putting so much medication, and I'm someone who doesn't even want to take a paracetamol. Like, as I grew up, I wouldn't take paracetamol, for like 2 or 3 decades. And here I am taking basically drugs people are outside trying to smuggle in or trying to buy. Especially students trying to study, all those overnighters. The interesting part I had with my nurse, she was telling me she wants to make this, every person is individual. And so everyone's experience is going to be very individual. It's going to work for some, it's not going to work for others. And what she said was, you trust yourself with doing your own medication. She'll tell me my max cutoff, but she was like, figure it out yourself. And not in a way of, just figure it out yourself, but it was a case of listen to your body. You will know if the medication is working with your body. So with that, we restarted everything. So we went back to the first drug, and I started taking it again. And she's like, okay.
Which is a funny thing to say, stepping back into matricins, where we're so off tune with our bodies, and now someone tells you, here, listen to your body, and you're like, trying the last couple of years. So,
well, so this is another funny thing that might be interesting for some people. Was I had this conversation, and she, my daughter was 3 at the time, and she was like, a lot of our patients that come into us are usually when the mother has just had their second child. They're in the 6-month region, because going from just managing a 3-family unit to now having to manage 4 can actually blow a mind, because you're like, I have so many balls to juggle. And so she said that's what she sees the most lately. That's what the nurse was telling me. So yeah, going back, it is a case of, it is very interesting about the idea of being more holistic and, trusting yourself, listening to your body, and, figure out the medication yourself, instead of, look, this is the max you can take. I just want you to know that. But for the rest of it, maybe you need 5 in the morning, maybe you need 20 in the morning, but you figure out what you're going to need. So that's basically what I did. And so I did that for about 3 months, to the point that it was kind of overlapping, the house hunt and the house, the paperwork and everything that goes along with it, then a lot of other personal issues. So I kind of we ended up having a conversation, and she said, the truth is, moving house is already going to be extremely stressful. And that's for someone who is neurotypical. So she said, this isn't working for you. And in a way, that was a very crushing sentence, because back in 2012 alone, I started my journey on mindfulness. I went to the UvA. I followed the mindfulness of Oxford with Mark Williams. I did quite a lot of many years of mindfulness, and I never could do it because it was such a big struggle. And I thought, oh, now I'm ADHD. This means I'm going to do this. And nothing was working. And it just felt like, when she said this to me a couple of months ago, like, let's stop this because it's not working for you. It was not that bricks came falling down and the ceiling came tumbling down on me, but it was just that thing of, yet again, You know, it was just that thing of, okay, so I have my diagnosis, I've been given the medication, but it's not working for me. So with that, as I said, one of the things in the last year is, you know, I'm meeting people, some of them have ADHD, ADD, neurotypical, non-neurotypical, neurodiverse, on the spectrum. Their kids have it, they have it, their parents have it. And there's been quite a lot more open conversations. And as Marlies was saying there about stigma, is 5.9% of the world's children have it, and 2.1% of adults have it. And yet I feel like I'm meeting so many people out there, and it's such a strange thing to be going around. This month is kind of important for me because my journey was not that it was hard. It was pretty simple. Like I would never have gotten tested. I know my house arts would never have suggested I got tested, but the fact that my therapist just said, look, here's a suggestion. The waiting was killing me, but the house art still helped me. She got it. I had the appointment and I've been going through it, and I went through it and I did everything I could, but it just didn't work out for me. You know, that's unfortunately my journey, and that's my experience. I know plenty of other people who have gone on the journey, didn't have as long a wait list, and medication worked for them, and, you know, fair play to them. Very happy that it's working for them. Equally, I know people who just couldn't keep waiting, so they ended up taking matters into their own hands and going back to their home country to get tested there and take medication back there. I mean, it's really all around, and it's a huge struggle. And the fact is, if you wait that long, that's why some people can't wait more. And so if there's any suspicion, it isn't a symptom thing where you've got a broken arm. It really is a case of, I would definitely suggest going to your house arts and having a conversation, see some key identifiers and just say, you know, these are what I suspect. Can you get me on the waiting list? You know, before it's too late, just get you on the waiting list. And if you have 9 months, and if by any chance you are seeing a therapist or you get to see a therapist and you have a conversation and you think, maybe actually I don't, you can always take yourself off the waiting list, but get yourself on the waiting list in the first place. It's covered by insurance anyway. So, I mean, that's where I'm kind of going with this is, if you have suspicion, go and get checked. Use your health insurance and use your house arts. And unfortunately, as Elena always says, is you have to advocate for yourself, and you have to speak up, and you have to push forward and say, you know, this is what I want, and this is what I really think it is. And so, you know, help me.
Yeah, and get the help. And it's not, you're not doing something wrong. And I also wanted to circle back just a little bit. So when they said this is not working for you, was your mindset then going into, oh, can I do anything right? Can I have this, like, can I be rightly sick? Or was it more the thing of, well, then it's your responsibility to figure out what works for me? Like, were you able to give that back and be like, I'm the patient, you see this is not working for me, so you get your ass running and see what's working for me? Or did you shift into, again, I'm not being sick, right? I'm falling through the hole. It's like, what was your, just to make sure that anyone who hears this and maybe hits the same roadblock, give them a little personal note on what were your thoughts then when you heard that?
So I have another condition. I was diagnosed with chronic back pain when I was a teenager. And when I was about, I think, 21, I ended up on a nearly 5-year cycle, or 4 years, actually, I think it was. Every 3 months, I had to see a different doctor to get past the diagnosis. And so I think it was 4 years. So it was 3 years and 9 months. So that's how many, 12, 15 doctors I had to see over this course to get approved to be told, yes, you have chronic back pain and now you can go to a pain management clinic. And so every 3 months I would get told, nothing wrong with you. We can't do anything. We can't see the pain. We can't see this. So when I was in my early 20s and even in my teenage years with chronic back pain, I got used to it. I got used to being told, no, there's no skeletal issue. There's no tissue issue. There's no hormonal issue. Yes, I have arthritis. But I mean, they were literally like, we cannot pinpoint. And so unfortunately, at a very young age, I've had to deal with this. Mm-hmm. And funnily enough, I've had to learn my red flags, which sends my body into fight or flight. Mm. And one of them is medical people, I guess. Yeah. Is because it's just when they tell you, I can't help you. Because at the end of the day, they're not God. And they don't have an MRI machine, which is going to see all your bones, your blood, your vessels, your ligaments, tendons, your brain. They're not going to see everything. And so, no, they don't have that ability to be able to say, I'm able to cure you. Not one doctor will ever be able to say that to anyone. And if they can, I think there's something, hocus pocus about them. So no, I don't blame them. And I unfortunately, it just means I have to go back to advocating for myself and researching and figuring it out and taking care of me. And now with the whole wide variety of information at our fingertips with social media and Google and God knows what else in this world, there's a lot more people out there who are very helpful. And so I'm learning who to follow, and I'm trying to figure out the me time then now I'm able to kind of pursue then all this information.
Well, and we hope that we can put together as much information as possible for you. If you have family member going through that process, or you might have some suspicions, or with yourself, your partner, or just maybe a friend also where you see some stuff, or you forward this episode to someone who you think could use this information, because the more we talk about it, again, with every topic, the more information we collect, the more we're sharing our experiences, our processes, and making it easier for the people around us, the people who are following behind in our footsteps, and so they don't have to do all the hard legwork. So hopefully this month will be lots of information around this topic. You've heard from Eva, who we're having on, Emma coming back, and lots of other interesting guests. Make sure that you check out our Instagram account, Damn Parenting Podcast, because this is where we collect all the information, the most important information from every episode. We will announce who's going to be on for the next one. And you can, of course, find all the information for the past episodes also on our Instagram account, Damn Parenting Podcast. Make sure that you subscribe to our podcast on Spotify, Apple Podcasts, or wherever you get your podcasts from. Give us also a 5-star rating so we get seen by other people who need a little more information and guidance through their parenting journey. Also, make sure that you share our episodes with your family members, with your friends, not just in the Netherlands, because we have, of course, a lot of topics specifically targeted to the Netherlands and Amsterdam, but we also have quite a big library now of psychological, general parenting topics, like the matrescence month is not linked to Amsterdam or the Netherlands. This is interesting information for people all around the world. So send this to your families back home, and hopefully we will hear you on the next episode. If you have anything to say around this topic of ADD, ADHD, then please get in touch with us, damnparentingpodcast@gmail.com, or via the Instagram, Damn Parenting Podcast. Or you could also comment under the episodes on Spotify. So there's lots of ways good to get in touch with us, to help us spread the word and leave your feedback. And we will hear you on the next episode. Bye.
Bye.